Dr. Ananya Goswami. Her study is surgical outcomes in pediatric rhegmatogenous retinal detachment, a comparative study.
Good afternoon, everyone. I'll be presenting on the surgical outcomes in pediatric rhegmatogenous retinal detachment. The slide is not moving. Pediatric retinal detachments are relatively less common compared to adult RDs. The complex etiology is a challenge for surgical management and has a poorer prognosis. The purpose of our study is to look at the anatomical and functional outcome of this pediatric rhegmatogenous retinal detachment in a tertiary care center. There is paucity of literature regarding the same in the Indian subcontinent, and this is one of the first study to compare the various techniques of pars plana vitrectomy, especially the role of short-term perfluorocarbon tamponade. It was a retrospective comparative case series. The primary outcome of our study was to look at the corrected distance visual acuity, and the secondary outcome is to look at the success and the associated complications. All cases of rhegmatogenous RD less than 18 years were included. Tractional RD and exudative RDs were included. Also, the cases who had undergone previous VR surgery were excluded. 288 eyes of 270 patients were recruited, and the following parameters were noted. The patients underwent either of the following surgery as per surgeon's discretion: conventional scleral buckling or pars plana vitrectomy with silicone oil tamponade. Along with that, encerclage of 42 band and pars plana vitrectomy and silicone oil tamponade, and pars plana vitrectomy along with short-term PFCL tamponade for 3 to 4 days, followed by PFCL removal and silicone oil tamponade. The outcomes of the PPVs were defined as absolute success where the retina was attached without any tamponade, relative success when the retina was attached with tamponade or there was peripheral detachment with attached macula without any tamponade. Failure was defined as detached retina under tamponade, and for scleral buckle it was defined as detached retina at 6 months. Coming to the results, the mean age was 12.6 years, 83% were male, the baseline visual acuity was 2 logMAR, 15% has systemic association. Most common etiology was trauma, closed globe injury comprising of nearly 25%. 34% had subtotal RD, out of which 45% had macula on. Incomplete PVD was seen in 93.4%, choroidal detachment in nearly 18%, 21.5% had more than one break, and PVR changes more than C were seen in 44%. Most common type of break noted was retinal hole. Moving on to the outcomes at 24 months, the overall success was 77%, while comparing the failure based on the age less than 12 years and more than 12 years, it was comparable. The visual acuity had improved from 2 to 1.5 logMAR at 24 months, which was statistically significant. Moving on to the group-wise analysis, in scleral buckle, the success was 71%. Comparing the various techniques of pars plana vitrectomy, the age and the preoperative visual acuity was comparable. In the PPV PFCL group, the PVR changes were seen in nearly 75%, and none of them had macula on RD. The final visual acuity in all the three groups were comparable. The success, overall success in the groups PPV was 71.4, PPV PFCL was 69%, and the PPV encerclage was 91%. However, in the encerclage group, for nearly 49% had to undergo resurgery. The complications noted were secondary glaucoma in 27.4% and corneal decompensation in 5.5%. The incidence of rhegmatogenous RD in childhood is 1.5 to 5.9%. Most common cause is trauma, which is similar to our study where 40% had cause as trauma. Closed globe is more common. The choice of surgery is as conventional, where vitrectomy was performed due to poor visibility of the fundus and break when it's not localized, and in cases of advanced PVR. PVR is more frequent in children because of delayed diagnosis and high intraocular cellular activity. 41.1% in our study had PVR more than C. Out of that, 9 eyes were closed funnel RD, which were in the PFCL PPV group. PPV endotamponade as a short-term endotamponade has been safe and effective and is safe up to 5 weeks. In adult rhegmatogenous detachment, the success is around 92%. However, there are no studies about the same in pediatric population. This is already discussed. To conclude, this study shows a high anatomical success along with significant functional improvement following surgical intervention for RRD in the pediatric age group. PVR-C shows a poorer prognosis. Overall success in all the techniques were comparable. However, in PV-PFCL group, it's more beneficial in those with advanced disease. Thank you.
This is a good analysis, but I feel that clubbing all cases like traumatic or just a simple rhegmatogenous and also the syndromic cases, that is FEVR and juvenile X-linked retinoschisis, is a bit of I don't think it is correct, because you see the syndromic patient, the FEVR and the juvenile retinoschisis will have much more vitreoretinal adhesions and much more problems. So the success rate we know in these cases is all low. So vis-a-vis, if you look at just a simple rhegmatogenous RD in a child or say traumatic RD, the success rate will be higher. So I think that is, you need to look at your preoperative characteristics of these patients, and you need to also do some subgroup analysis based on that.
Yes.
I think it's okay.
Thank you.
Thank you very much.